Hello students, our today's topic is about splenomegaly. So first of all, spleen we know it's a normally not palpable. It has to be enlarged 2 to 3 times before it becomes palpable. So a spleen it is an organ in your body located on the left side of your abdomen. It is usually not felt by touch unless it becomes significantly larger. So when it gets enlarged, we call it as palpable spleen. So normally a person would not feel their spleen because it is not big enough to be felt. However, sometimes even in healthy people, the spleen can become slightly larger without any sickness or any disease. So in some cases, especially in certain tropical areas, more people might have palpable spleen. So when the lower part of spleen is larger and extend beyond its usual position, it is important to further check to find out the reason behind this. Well, the mild enlargement of the spleen, it does not cause any noticeable symptoms. But when the spleen it grows larger, it can lead to feeling of discomfort. You can feel pain or heavy sensation on the upper side of the abdomen. In extreme cases, a greatly enlarged spleen might make a person feel full after eating only a small amount. Sometimes sudden or rapid enlargement of spleen can cause severe pain in the left upper abdomen or the lower left chest due to stretching or inflammation of spleen. Typically, radiographic tests like ultrasonography they are used to confirm the presence of enlarged spleen. So these tests can accurately measure the size of spleen and differentiate between the spleen enlargement and other issues like that could be the kidney problems. Now, what are the causes, various symptoms and signs that what are the various symptoms and signs that might indicate potential cause of enlarged spleen? The cause of the massive splenomegaly that is greater than 8 centimeter or greater than 1000 gram, they are mentioned. That includes the specific disorders like myeloproliferative disorders, CML, myelofibrosis, polycythemia vera. So these types of leukemia, like the hairy leukemia, chronic lymphocytic leukemia, lymphomas, Gaucher disease, autoimmune hemolytic anemia, that could be the cause of the massive splenomegaly. What are the symptoms associated? Symptoms could be pallor that indicates anemia, skin issues, fever, icterus, jaundice, joint or bone pains. One may feel respiratory or cardiac symptoms or the lymph node enlargement. So all these can provide you clue to the possible cause of the splenomegaly. Additionally, it also points out congenital conditions like beta thalassemia, hereditary spherocytosis, or the sickle cell anemia that may also suggest certain genetic cause. Now, what could be the laboratory assessment? What could be the laboratory tests? First of all, the blood count, complete CBC count with a differential and peripheral blood smear. It helps to identify the abnormality. It can indicate a condition like the anemia, abnormal WBC count, increased or decreased count that would indicate infection or leukemia. Second, you can do is bone marrow examination. Recommended when a malignant blood disorder or infections like Kala Azar or tuberculosis they are suspected. Third, you can test for various infections like malaria, Kala Azar, bacterial, viral infection through smear, antigen test. You can perform cultures that can help you in diagnosis. The next is the test for the myeloproliferative disorder involving looking for the specific blood counts pattern, differentiating cell types, and doing immunophenotyping. The fifth, liver function test and ultrasound Doppler assessment, they are used to identify the liver-related cause, like in case with the portal hypertension. Apart from that, test for the erythrocyte segmentation rates, anti-nuclear antibodies, rheumatoid factor, that helps you to diagnose the autoimmune disorders. Various other tests like reticulocytes, Coombs test, serum bilirubin, they help you to diagnose condition like the condition that cause the breakdown of red blood cells, that is through the hemolytic disorders. Now, what are the causes of splenomegaly? That is according to the size of spleen. It can be either massive, it can be either non-malignant or the malignant. The causes of non-malignant are the chronic malaria, tropical splenomegaly, Kala Azar, polycythemia vera, Gaucher disease, thalassemia major. Whereas the malignant, that could be CML, hairy leukemia, lymphoma, etc. The example of moderate splenomegaly could be portal hypertension with congestive splenomegaly, chronic hemolytic anemia, sarcoidosis. The malignant could be lymphoma, chronic myeloid leukemia, chronic lymphocytic leukemia, acute leukemia. The mild example of mild splenomegaly could be the infections due to bacterial like salmonella, tuberculosis, subacute bacterial endocarditis, viral. It could be due to the viral infections including the infectious mononucleosis, viral hepatitis, cytomegalovirus, AIDS. It could be due to the fungal infections like parasitic malaria, leishmania megaloblastic, or the SLE. Now, the most common symptom that is produced by the enlarged spleen are the pain and heavy sensation in the left upper quadrant. Occasionally, the pain may be present with severe pain in the left hypochondrium or lower left chest due to rapid or acute enlargement of spleen that results in stretching of the spleen with the stretching of the capsule. So enlargement of the spleen can be made on palpating supine position or left lateral decubitus position. Remember, the enlargement of spleen more than 8 cm beneath the left subcostal margin, it is known as massive splenomegaly. Remember, the presence of icterus may suggest hemolytic anemia or the liver disease as possible cause of splenomegaly. Skin rash may occur in acute and chronic infective stages. Cloudy cornea and cherry red retina spots. It may be suggestive of metabolic storage disorder like the mucopolysaccharidosis. The presence of respiratory and cardiac symptoms may be secondary to congestive heart failure. Severe anemia or a new murmur may be clue to the infective endocarditis as cause of mild splenomegaly. The presence of prominent veins over abdominal walls, ascites, enlarged or shrunken liver may be indicative of portal hypertension and liver pathology as cause of splenomegaly. Patient with a history of joint pains that could be rheumatoid arthritis, SLE, or bone pains. That is, leukemia may be important clue to diagnose the splenomegaly. Remember, the splenomegaly, enlarged spleen, it may be seen in conditions like congenital hemolytic anemia like the beta thalassemia, hereditary spherocytosis, and sickle cell anemia, in which the family history may also be present. The non-cirrhotic portal fibrosis occur in older and young individuals. The presence of generalized lymph nodes enlargement may be cause of lymphopoietic malignancy that could be a cause of splenomegaly.